Well, the good news is that we have several options to correct that. And just like one of the signs of aging is volume loss, we've had many treatments for that. We use those same things with these patients. And that can start with in-office injectable treatments such as Juvederm or Restylane. We've used those for years with great results. Or for those patients who want a longer-term solution, we can do surgery. And that can include things like autologous fat grafting, redistributing fat from where you want to get rid of it to where we'd like it in the face, or implants, whether it's cheek implants or chin implants. And then lastly, for those patients who just have so much volume loss, the skin is sagging, we can do surgery. And that can include like a lower facelift or a neck lift to help lift and reposition those sagging tissues. So good news, we have great medications for weight loss, and I think these really are a big advancement and will really help the healthcare of our country. But two, for those who are seeing this side effect, we have some great options for bringing back your face and rejuvenating it to where it was before. So hope that helps and look forward to seeing you soon.